Do20 is located in relation to the midpoint between the glabella and the occiput. Place the heel of your palm on the glabella and the occiput. Fold your fingers around the skull to find the midpoint. Do20 is located 1 cun posterior to that midpoint. It typically lies in a nice dip. There are several other nice dips slightly further back, which are other do points, so don't be tempted to go further back than 1 cun posterior to that midpoint. Do17 is on the posterior midline. It's 1/4 of the distance between Do16 and Do20. Do17 is 1.5 cun superior to Do16, but more importantly, it's in a nice depression at the superior border of the external occipital protuberance. Do25 is on the anterior midline at the very tip of the nose. Do26 is on the anterior midline at the junction of the upper third and lower 2/3 of the philtrum. Ren24 is on the anterior midline in the centre of the mentolabial groove.
Do14 is on the posterior midline below the spinous process of C7 in a depression. Do4 is on the posterior midline below the spinous process of L2. Ren17 is on the anterior midline level with the 4th intercostal space. Ren15 is 7 cun superior to the centre of the umbilicus on the midline.
Large intestine 14 is located on a line joining large intestine 11 to large intestine 15. It's often described as being 3/5 of the distance between large intestine 11 and large intestine 15, but this isn't always very accurate. The best way to find it is to have a person adduct their arm against pressure and then palpate down until you find a nice depression on the inferior aspect of the deltoid muscle. It's important to realise that when the arm is relaxed, this point isn't at the exact tip of the deltoid, it's slightly anterior and slightly superior on a line joining these 2 points. Large intestine 11 is located at the midpoint between lung 5 and the prominence of the lateral epicondyle of the humerus. Typically, this is at the end of the transverse cubital crease when the arm is fully flexed.
Large intestine 5 in the anatomical snuff box. I'm going to ask Laurie to extend his thumb under resistance, and that brings the snuff box into relief. And just relax. going to articulate the wrist to find the deepest part of the hollow now it's relaxed. And I'm going to put my point in, which is in between the two tendons of extensor pollicis longus and brevis. Large intestine 4, you're going to find the length of the second metacarpal bone. So running your finger down, finding the base, making sure that you're not actually on the carpal bones themselves, finding the midpoint of that shaft of bone, coming between the first and second metacarpals, nearer to the second than the first in the muscle.
Sanjiao points on the forearm are best located with the arm laying flat on the bed and the elbow turned outwards. To find Sanjiao 5, come 2 sun proximal to Sanjiao 4, in between the radius and the ulna. You should be on the radial side of the tendon of extensor digitorum communis. If the person wiggles their fingers, this tendon will come into relief.
Heart 4 is on the flexor aspect of the forearm. It's 1.5 sun proximal to heart 7, radial to this flexor carpal ulnaris.
Bladder 67 is the lateral nail point of the little toe. Be sure to mark it clear of the nail bed. Bladder 62 is located half a sun inferior to the inferior border of the lateral malleolus. It is located posterior to the perineal tendons. To bring the perineal tendons into relief, evert the foot. This is the perineal tendon here. When the foot is relaxed, the point can then be marked behind it. Bladder 58 is 7 sun directly superior to bladder 60. It's often described as being 1 sun inferior and lateral to bladder 57, but that's not always the case. Bladder 57 is located on the posterior midline of the lower leg in a depression inferior to the 2 bellies of the gastrocnemius muscle. To find this depression, have the person point their foot. If you can't see the depression, palpate round, feel the bellies of the gastrocnemius and the Achilles tendon and spiral round until you can find a nice dip. This point is often described as being 8 sun superior to the lateral malleolus, that is, halfway up the length of the lower leg. It's not always there. Please go with the local anatomy to make sure you find this point correctly. Stomach 32 is located 6 sun superior to the superior border of the patella on a line joining the lateral border of the patella to the anterior superior iliac spine. If you divide the distance between the superior aspect of the patella and the prominence of the greater trochanter into 3 equal parts, this point will lie just a little more proximal than the lower third. Stomach 36 is located approximately 13 cm superior to the prominence of the lateral malleolus on the anterior border of tibialis anterior. The easiest way to find it is to palpate down the tibial tuberosity. Find the base of the tibial tuberosity and move slightly laterally until you fall into a nice dip on the anterior border of tibialis anterior. This point is also 3 cm inferior to the inferior border of the patella. Gallbladder 34 is located in a depression which is anterior and inferior to the head of the fibula. To locate the head of the fibula, find the tibial tuberosity and move laterally until you find a prominent bony landmark. Be sure that you don't confuse the head of the fibula with the lateral condyle of the tibia, which is closer to the kneecap. Liver 4 is located in a depression directly anterior to the prominence of the medial malleolus, but medial to the tendon of tibialis anterior. To bring this tendon into relief, dorsiflex the foot. So if you can relax. Don't confuse this point with spleen 5, which is much lower down. It's directly anterior to the prominence of the medial malleolus. Gallbladder 39 is located 3 cm superior to the prominence of the lateral malleolus. It's in a groove in between the lateral crest of the fibula and the perineal tendon. Get your patient to avert their foot against resistance to reveal the perineal tendon. Be sure to locate this point in the groove between bone and tendon, not posterior to the tendon.
Kidney 1 is on the sole of the foot, between the second and third metatarsals, approximately 1/3 of the distance between the base of the second toe and the heel. It falls into a depression when the foot is plantar flexed.